Again, thank you all for being here today. I really appreciate it. My name is Katie Maguire-Jack, and the title of the talk today is The Community Context of Child Maltreatment. So I'm going to begin by giving you some background information about myself to explain why I'm doing the work that I'm doing. I want to give you a high-level overview of the research contributions that I have made to date so that you can kind of understand who I am and what I'm all about. And then I'm going to go through one very specific study so that you can understand the type of statistics that I typically use, and it's pretty representative of the type of work that I do. And I'll talk about my love for teaching and what I would be interested in teaching here at Michigan, and then why I'm interested in you all. So that's my plan. I'm happy to take questions at the end, or if there's something that's not clear as we go through, that would be fine if you want to jump in. So some background information on me. I'm originally from Wisconsin, and maybe my accent will come out more and more as I go. We'll see. I try to control it when I can. So my education, as Dr. Herrenkahl said, was at the University of Wisconsin. So I went to Madison, and my first master's degree was in public affairs at the La Follette School of Public Affairs. And I was specifically focused on poverty policy. And after I finished that degree, I went to work for the state of Wisconsin legislature. And I worked for an agency, a nonpartisan agency called the Legislative Fiscal Bureau. And I was a fiscal analyst, and I was in charge of the state of Wisconsin child welfare budget. And it was a great learning experience for me. And it was during that time that I became really appalled by the amount of money that our state was spending on intervention after child abuse and neglect happened compared to what we were investing in trying to prevent the problem from happening. So just to give you an idea, in one county, Milwaukee County, we were spending over $100 million a year on intervention after child abuse and neglect happened. And then we were spending less than $3 million on trying to prevent the problem from happening across the entire state. So less than 3% of the resources were being invested in prevention compared to intervention. And my state bureaucrat hat said, we could probably be saving the taxpayers' money if we were investing more in prevention and trying to stop this problem from happening. And my social worker humanity hat was saying, wouldn't it also be great to prevent these experiences from happening for kids, not just the money? So I sort of naively thought at that time that I work for the legislature, so I'll just convince them to spend more on prevention. They'll listen to me. They don't, right? In order to try to convince them, I went to the research to look at what we were spending the dollars on and what I could say about those programs. And there was a big disconnect between what we were providing in terms of there wasn't a lot of evidence base for what we were doing. And so my ability to say, if you spend more money here, you will get this outcome was very limited. And so I thought, well, I'll just tell them what to spend the money on, and then I can convince the legislature to invest more resources. And what I found out was that there wasn't a lot of knowledge in this area. We didn't know a whole lot about different types of programs that could prevent child abuse and neglect from happening. And so the state agency was doing the best job that they could with the knowledge that we had. And so it was at that time that I decided, if I really want to make a difference on this problem, I need to think about doing something different. I'm not going to be able to make a change just reporting these numbers out ad nauseum. And so that was when I decided to go back and get my PhD and my master's in social work at the University of Wisconsin. And so I went back in order to study prevention programs, to study prevention strategies so that we could really infuse these different types of services in communities in order to try to prevent maltreatment from happening. During my PhD, I also worked for the Wisconsin Children's Trust Fund, which is that same agency I was just talking about. I got a soft spot for them when I was overseeing their budget. I worked for them as a program and policy analyst, so I got to do a lot of really cool program evaluation for the strategies that they're doing, and it also allowed me to gain entree into this group of people who were interested in this idea. And so I was able then to leverage that in order to get funds for research later, and it allowed me to make connections at the Ohio Children's Trust Fund, as well as the Michigan Children's Trust Fund. So my current position, I've been at Ohio State. Please don't, I'm a Buckeye at the moment. It's funny. I was telling Karen in my hotel room, there's a cartoon of a Michigan football player beating an Ohio State football player. So that was quite funny for me. And I'm in my 6th year there. I just achieved tenure last spring. So now I'm thinking about what to do next. So these pictures are all kids who have been served by different programs that I have evaluated, except for the little one on the horse. That's my son when he was about 18 months old. He's 7 now, but he loves to be in the pictures, so I always keep him there. So just a high level overview of what it is that I do. So I've stayed true to that prevention call that I had so many years ago when I worked in state government. So I really think about my research as being 2 strands. So I look at neighborhoods and trying to understand geographic variation in child maltreatment. And the reason why I started focusing on that area is because when I was working on my PhD and I was doing these different program evaluations, there were 2 different things that caused me to be interested in this. First, it was that we saw different programs working really well in one context and not working well in other contexts. And so trying to understand why that would be. And then the second piece is that we saw huge variation from one place to the next in terms of the child maltreatment rates. And I kept hearing different people talk about how that was a problem. And so I went and I looked at I made some maps of the NCANS data, which is the federal data. And you can see it state by state, there's huge variation in child maltreatment rates. You break it down within a state, county by county, there's huge variation. And then you break it down further, neighborhood by neighborhood, and there's also variation there. And so I became really interested in understanding, I'm kind of a mover, so sorry. Understanding the context where people live and what it is about where they live that affects their parenting. And that is married with the prevention strategies piece of me because we need to know what it is about the communities that's working that allow these different prevention strategies to flourish and prevent maltreatment from happening. So these 2 pieces are really together for me. And that's sort of very high level what it is that I do. So just one theory that I want to talk about briefly that you probably are familiar with, but just in case, the social disorganization theory has really guided the work in understanding neighborhoods and child maltreatment. So social disorganization theory was not originally a maltreatment theory. This theory came out of juvenile justice literature, trying to understand why they saw different rates of crime and delinquency by neighborhood. And they looked at these different structural characteristics of neighborhoods. And structural characteristics, one really easy way to think about that is things you could very easily measure with the US Census. So things that the data exists, it's like the collection of demographic characteristics of neighborhoods. And so within the social disorganization model, they looked at poverty, residential mobility, so people moving in and out of the neighborhood, and then ethnic heterogeneity. This original model came from in 1942, so it's a little bit older, classic. And the idea was that when you have high levels of these factors that they called social disorganization, within the neighborhood, then you have an inability for neighbors to watch out for each other, to work together, to achieve common goals, and things of that nature. So Sampson and colleagues then have brought this theory back to the forefront and have really tried to not just look at those structural characteristics, but also those things that we refer to as the processes. And so the processes are really collective efficacy, which is made up of 2 different things, which is social cohesion, which is the bonds that you make with your neighbors and the extent to which you trust them and you think they share your values. And then social control, which has to do with the extent to which you think your neighbors would intervene if they saw problems happening. The child maltreatment scholars who were interested in neighborhoods, it's a small little group of us, but they started applying this theory to the problem of child maltreatment. And so they've looked at a lot of the same things. One thing that has been added is a structural factor called childcare burden. And childcare burden relates to the number of kids in a neighborhood relative to the number of people available to take care of those kids. In terms of the literature related to child maltreatment, the neighborhood poverty factor or concentrated disadvantage seems to be the most robust structural factor, where above and beyond the impact of being poor yourself, living in a low-income neighborhood tends to increase the risk for child maltreatment. The other factors, the results are much more mixed, where sometimes they're found to be significant and others they're not. So I love this little map. I was just telling Todd that my sister is an art therapist and she also loves graphic design. So I asked her to make me a map that would display everything that I want to talk about today, and I don't have these skills. So this is my neighborhood, not my neighborhood, but a neighborhood. And so within the community context of child maltreatment, within the neighborhood, there's lots of different things that could potentially affect parenting. And the first thing that I was really interested in understanding was proximity to social services. So you can see on my map here, it's the direction from that person's little house up to the WIC clinic. And so we think that proximity to social services might matter for child maltreatment, because if you have better access to services that can help resolve social problems that are found to be related to child maltreatment, perhaps it improves your parenting. So in my dissertation work, the first study that I did was looking at spending on child maltreatment prevention programs. And what I found was that if you increase funding for child maltreatment prevention programs, it decreases an individual parent's risk for maltreating, which is great, right? That was what I was originally interested in knowing when I was a fiscal analyst or a state bureaucrat. So good, it worked, right? And then when I got to OSU, I became interested in understanding not just those very narrow services that have the goal of preventing maltreatment, because in my brain, I think of a lot of other different types of services as being child maltreatment prevention services, even if they're not trying to prevent child maltreatment, right? So substance use services, I think of as a child maltreatment prevention strategy, poverty services, etc. And so in one study, I was looking at data from Los Angeles County, California, and we found that proximity to behavioral health services was associated with a decreased risk of neglect. I then collected data myself in Franklin County, Ohio, which is Columbus, and we found that proximity to substance abuse services was associated with lower rates of physical abuse, but this was true for white families, but not Black families. Similarly, we found that proximity to poverty services was decreased with self-reported neglect in white families, but not Black families. And so I think for me, this raises a really interesting question as to why that might be. Columbus is interesting because the services are actually closer to low-income families. In broader research, it suggests that they're not sufficiently targeted, but in Columbus they are, but they're not equally protective among different groups. And so trying to understand why that might be is an important question that I hope to investigate. Not today. So this is my picture of social control. So I asked my sister to draw a creepy guy peeking out of the window, watching over the neighborhood. And so social control has to do, as I mentioned before, with do you think your neighbors would intervene if they saw a problem happening? And so this guy is our social control. And so people think that this is related to child maltreatment for a couple of reasons. Number one, on the more positive side, if you might feel less stressed if you feel like other people in the neighborhood are watching out for the common good, and that if your kids are in trouble, someone will help them. So that could increase your personal well-being. But additionally, if you think your neighbors are watching you and they might call social services, you may be less likely to maltreat, at least publicly. And so in a couple studies I have looked at this, and I have found that perceptions of higher levels of social control are associated with lower rates of self-reported abuse and neglect. Social cohesion has to do with the connections between people, and so people believe this to be related to child maltreatment because you have people you can rely on, that you can talk to if you have problems. You have people, if you have an emergency and you need to get into work, you have someone where you could drop your kids off and you trust that person. And so I've looked at this in a number of different studies. It's something that I'm very interested in because I think it is amenable to intervention, where I think we could do some things to increase social cohesion within communities. And so what I have found is that higher rates of social cohesion is associated with lower rates of abuse and neglect, and especially physical needs neglect. So neglect is kind of a unique form of maltreatment where it's made up of lots of different things and it's hard to nail down. It depends on who you talk to of what they think neglect is. One common way of splitting neglect is into basic needs neglect and then supervisory neglect. So basic needs being, are they fed? Are they wearing a winter jacket today? And then supervisory neglect has to do with watching the child, making sure that they're safe. And so within these studies, I found that social cohesion was especially related to physical needs neglect. This was among a low income sample, so I think that potentially makes sense. If you have people you can call on to say, could we come over for dinner tonight? I can't make it to the end of the month. So that was interesting. I talked about these structural characteristics, and I already mentioned this, so I don't want to waste too much time, but neighborhood poverty does seem to be robust across many, many different studies, many different samples, many different ways of breaking it down, ways of measuring child maltreatment. There does seem to be something there where neighborhood poverty is associated with a higher risk of abuse and neglect beyond, above and beyond your own individual poverty level. And then the final high level thing that I want to say is that it's not just the objective reality of the neighborhood, but it's also how people perceive your neighborhood. So these are my child welfare workers. It looked like they were working on a clipboard or something, so I thought they looked like child welfare workers. Um, and so it's not just what's really there, but it's what the child welfare worker thinks about the neighborhood when they're trying to make these decisions. And there is some evidence that the external factors like community poverty, single-headed households, and rurality affect the decision to substantiate. And oftentimes we rely on official records of maltreatment. So substantiate, if you're not a child maltreatment person, is basically similar to finding guilty that it happened. And so the child welfare worker has a lot of leeway in making that decision. And so these external factors can come into play. But one thing that was interesting that we found using data from across the United States, from every county, from the NCANS data, we had special access to it, was that the context, they matter, but it matters differentially by race, meaning that the child welfare worker potentially is interpreting risk of the context differently by race of the child. So that was fascinating. So one very concrete study, a specific example that's pretty representative of my work, I was trying to understand how individual and neighborhood disadvantage interact with each other to affect risk for child maltreatment. So at the individual level, there's an extensive literature linking income and poverty status to both CPS involvement as well as self-reported maltreatment behaviors. There is a lot of different theories on why that might be. So one is selection. So for, individuals who are low income may have more other risk factors that are associated with maltreatment. So for example, substance use. If substance use rates are higher in lower income people and substance use is what causes maltreatment, then potentially you have a selection issue going on. The second one is neglect. I mentioned that that one is difficult. So failure to provide is one form of neglect. It's also that basic needs neglect I was talking about. And so that could happen because of an unwillingness to provide or an inability to provide, right? And most states have some sort of policy around other than for reasons of poverty alone. But in practice, that is very hard to disentangle, right? It's very hard to say that this was because of an inability to provide versus this is because of an unwillingness to provide. Another issue is possible surveillance bias. So low-income people may have more contact with mandated reporters. So if they are receiving public benefits and they are interacting with folks like us, social workers, we are mandated reporters. And so lower-income people, even if a high-income person and a low-income person have the exact same behaviors, the low-income person is more likely to be reported for that behavior because they see more of these mandated reporters. And then the final reason is the family stress model from Conger and Elder. And that model suggests that when there's economic hardship, that there can be distress within the marriage, and then that can lead to harsher parenting. They've also looked at it within single parent families, and that there does seem to be a link there in terms of economic deprivation, stress, physical abuse. At the neighborhood level, there's a growing evidence on associations between neighborhood poverty and CPS involvement, as well as self-reported maltreatment behaviors. There is a stronger, seems to be a stronger association between the poverty and CPS involvement as opposed to poverty and self-reported maltreatment behaviors. So that could be a possible surveillance bias, like I mentioned. Another area or another way in which this might happen is that in lower income neighborhoods, there may be less access to services and resources. So there's a literature to suggest that we're not targeting social services very well. Surveillance bias can also be just within the neighborhood, right? So if you have a higher police presence within your neighborhood, then you may be more likely to be reported. And then stress. It can be stressful, as you can imagine, to live in a highly disadvantaged community and you don't have anyone that you can rely on. Everyone around you is suffering, and it seems like you're never going to get out of this situation. You can imagine that that might affect your mental health or your emotional well-being in a way that could affect your parenting. So how might these things interact with each other? So our social ecological model suggests that there's multiple levels at which things happen and they interact with each other in important ways. And so poor neighborhoods might affect non-poor people less. This is one theory. They might affect poor people less because, higher income people less because higher income people have more ability to get out of that neighborhood. So they can leave to go work, they can leave to go get services, they can leave to have social connections in other areas. So potentially if you are higher income, you may not be as affected by the lower income neighborhood. On the flip side, lower income individuals living in higher income neighborhoods may face more stigma than poor people living in a poor neighborhood. If you are the only low income person in a higher income neighborhood, you could face more stigma than if you were surrounded by people who were like you. So these were the things that we were curious about. So the research question was whether there are interactive effects of individual and neighborhood poverty on the risk of child maltreatment. So I collected these data in 2014 in Franklin County, Ohio. It was a rather Herculean effort. It was like a small seed grant over the course of 1 month, 8 hours every day in 6 WIC clinics. We got 1,000 people, myself and 3 undergrads. And we had a really high response rate, surprisingly. We had $10 gift cards available, and the survey took about 10 minutes to complete. And they were a captive audience, so they were there waiting for their WIC appointments to happen, and often they wait for 45 minutes for that to happen. So we had this 10-minute survey they could do and immediately get their gift card, and I would hold their babies while they took the survey. So we had over a 94% response rate of the people who were approached. Our analytic sample after excluding the missing, so we excluded people who were missing either maltreatment or poverty data, and that brought us down to 946. So our sample, even though we were in WIC clinics, we had 18% male. You might have assumed that in WIC clinics, it's mostly going to be mothers who are going for these appointments. But we did have 18% of the sample was dads who were going along for the appointment. 31% of them were white, 58% were black, and 11% were some other race. 27% of the sample was either married or widowed, and then 38% had less than a high school education. 27% of the sample had lived at their current residence less than 1 year. So there was a pretty high rate of residential mobility within the sample. And then the average age was 32. So we proxied neighborhood as zip code, which I will give I will fully admit that that is problematic. So normally you would go down to like the census tract level, but we did not have sufficient numbers of people in census tracts. We had like 1 person in a census tract. And so we went up to the zip code level in order to be able to run the models. Yeah, it's just a limitation. So for maltreatment, we use the parent-child conflict tactics scale, which is a self-report measure of child maltreatment, and it includes 4 different subscales: child neglect, psychological aggression, which is similar to verbal or emotional abuse, and then physical assault, which is similar to physical abuse. And we used count measures that we dichotomized at the 90th percentile. So within our sample, they, as you can imagine, were over dispersed at 0 and 1, with most people saying we don't maltreat, or if we did, it happened just one time. So we dichotomized to try to get the highest, most severe forms of maltreatment. In the actual paper, we also looked at any maltreatment reported, but I'm only focusing on these results for ease of presenting. For poverty, at the individual level, we had a measure of material hardship. And so this is an alternative to using income as poverty measure, which we tend to like a little bit more because it really gets at the experiences that you have. Because if you have two people who both earn $10,000, but one of them, their mother or extended family is paying their bills and helping them with everything, and the other person is a single parent trying to do everything on their own, those are really different experiences. And so the material hardship scale is better able to capture the actual experiences. And so the questions are things like, in the past 12 months, did you ever get evicted because you couldn't pay rent? Did you ever have to use a food pantry? Did your utilities get cut off, etc.? And we considered someone to be poor if they had two or more items on that scale. And the way we chose it was we looked at the distribution, and that was a meaningful cut point. We did run some sensitivity tests where we cut it at different levels to see if that mattered, and it didn't. And then neighborhood level, from the census, we considered the zip code or neighborhood to be poor if they had at least 35% of residents under the federal poverty line. And we used that one for the same reason with the distribution, and then we also ran sensitivity tests around that. So our final measure, we had these four categories of people. So we had 31% of the sample was the most advantaged group, which was they were not poor themselves, and they also lived in a neighborhood that was not considered poor. 33% of the sample was an individually disadvantaged person, so they were poor, but they lived in a higher income neighborhood. 16% of the sample is the smallest group, and those are the people who are higher income themselves, but they live in a more disadvantaged neighborhood. So they are neighborhood poverty only. And then the fourth group is the doubly disadvantaged group. So 20% of the sample was both low income themselves and lived in a higher poverty neighborhood. We controlled for parenting stress, the sex of the parent, the number of kids in the household, whether it was a single parent, their educational attainment, the housing instability, which was that measure where it asked if you've moved in the past year, and then the race of the parent, and the neighborhood racial composition. So we control for the neighborhood racial composition because unfortunately Columbus is not unlike a lot of other large cities where we have a lot of segregation that still remains today, and there's a huge overlap between percent Black and percent in poverty. So most of the neighborhoods that have a higher poverty rate also have a higher rate of Black residents. And we were trying to look at poverty. So we did a two-level, multi-level logistic regression model. And we had respondents at level 1, so the parents were at level 1, and then zip codes were at level 2. And if you're not familiar with multi-level regression, probably everyone in this room is, but if you're not, it sounds harder than it is. It runs regressions at both levels at the same time, and it allows you to parse out how much the neighborhood matters versus how much your individual status matters. Which is really cool because a lot of the work before we discovered this method was just using the neighborhood poverty rate and looking at child maltreatment rates, and that really can overestimate the impact of the neighborhood because it could just be that there's a collection of people there who are low income. And then we used Wald tests to be able to test whether the differences between the group were statistically significant. And we did run 2 sets of models, and I'm only showing you the 90th percentile of maltreatment today. So here's the table. So the column that is probably most helpful to look at is the odds ratio, adjusted odds ratio columns. And so if you're not familiar with looking at odds ratios, if it's over 1, it means greater risk. And if it's under 1, it means less risk or decreased odds. And so the control variables I don't show here just because then the table gets really small and it's hard for people to read. But what we found here was pretty interesting. So for neglect, we found that individual poverty only, so the comparison group here is the group who is higher income and in a higher income neighborhood. And the folks who were individually poor themselves were at a higher risk for child neglect or had increased odds of reporting neglectful behaviors. And then the same was true for those who had neighborhood poverty only, but they were higher income themselves. And then the largest odds ratio is for those groups that we called that have both, that have the neighborhood poverty and the individual poverty. However, it's important to look for the little subscripts of the letters. So you can see that they're not actually statistically different from each other. So for neglect, all three of those things are bad, right? It's bad to be low income yourself. That increases your risk for child maltreatment or increases your odds for neglect. Living in a low income neighborhood increases your odds for neglect, and having both increases your odds for neglect. And they're not different from each other within our sample. Physical assaults, we found that individual poverty only and being individually poor and in a low income neighborhood were both associated with a higher odds of reporting physical assaults. It was not significant for the higher income people living in a low income neighborhood. And then psychological aggression, excuse me, is probably the most interesting one. So we found that the only significant finding was those individuals who were individually poor but lived in a higher income neighborhood. So that was a higher risk for for verbal abuse. Excuse me. I'm just going to call it verbal abuse because when I see psychological and physical next to each other, I say the wrong word. Your risk for verbal abuse was higher if you were an individual who was low income but living in a higher income neighborhood. And that was statistically different from the people who had both individual poverty and neighborhood poverty. So it was actually worse to be a low income parent in a higher income neighborhood than to be a low income parent in a low income neighborhood when it came to emotional abuse. So there's limitations. It's very geographically limited to a large urban city, Columbus, Ohio. We did have smaller ends for individual zip codes. Um, there are issues with the conflict tactics scale. This is a self-report measure of child abuse and neglect, and as you can imagine, people don't like to say that they abused their kids. One way that I know that it's not 100% reliable is there's this question of how many times in the past month did you yell at your child? And everybody says like never or one time. And I just, I'm a parent, and so and I do this for a living, right? And so, but you would be surprised at how much people do report on these things. So we didn't have a single measure that didn't have at least one person who said more than 20 times in the past year or in the past month. And some of them are very severe, like threatening with a knife or a gun. So you would be surprised. But again, they are more likely to underreport their behaviors. The neglect measure, especially, I don't like because it has 5 questions and they're all very different from each other. And then the count of instances, when we're counting up how many times it happens, it really masks the severity because as you can imagine, there might be something that happens every day, but it could be more minor than a very severe one-time physical assault, right? So if you're counting up, 20 times I hit with a hairbrush. I don't know if you'd consider that severe or not severe, but then one time you completely really harmed the child, that one could actually be more severe than the 20 times. So it's hard to measure these things. It's our struggle. And then there are other measurement issues. So I mentioned that we used material hardship instead of income-based poverty. I've got a question mark there because we can debate on which one you like better, but we did not use the income-based measure. And then there were analysis issues. Specifically, I already mentioned this, but there was a substantial overlap of race and poverty. We tried to control for that by including the percent Black within our models, but it is a problem. So the extent to which we're seeing neighborhood poverty mattering, it also could be the percent African American within the community. But we did control for it, so hopefully that's not in there. And then selection into neighborhoods to varying degrees, and we can talk over coffee sometime about how much we believe this, but to varying degrees, people do have choice in where they live, right? Lower income people maybe less so have choice, but you could imagine in a scientific way that a person who wants to maltreat their child might choose to live in a more socially disorganized neighborhood because they think that they'll get away with it. So that's not something I believe myself, but my reviewers always comment on it, so I just throw it out there before you say it. finally, in terms of the conclusions and the implications, so overall, the maltreatment rates of poor parents in high poverty neighborhoods were similar to the maltreatment rates for the poor parents in lower poverty neighborhoods. So um, it the being a poor parent in a higher poverty neighborhood, the neighborhood didn't protect them. That's basically what I'm trying to say. If you were a low income person, you were still more likely to maltreat your child. And with the interesting exception of physical abuse, where living in the higher income neighborhood was actually more harmful. And so, what we think might be happening there, and this is just totally conjecture, but that there's something about being different. If you are the only low income person within your neighborhood, that maybe that increases your stress in a way, that maybe you're yelling at your children more to try to, get in line and act like the other children or something. We're not sure. But there does seem to be something about the stigma of being a lower income person. And then both individual poverty and neighborhood poverty matter. So the risks of neglect were equivalent for a non-poor family in a high poverty neighborhood and a poor family in a low poverty neighborhood. So you can't just intervene on one or the other. Both of those things matter for child neglect. But both of those groups were at higher risk than the non-poor families in the lower poverty neighborhoods. So that's the end of that very specific study. And I'm going to just um, switch gears. That's the word I was looking for. So I mentioned that I do this neighborhood work, but then I also continue to do this child maltreatment prevention work. And so I just want to talk to you about some of the programs that I'm currently working on because I'm excited about them. So one of them is called Ohio START, which stands for Sobriety, Treatment, and Reducing Trauma. And this is a program that has come to fruition in light of the opioid crisis. So probably most of you have heard that there's an opioid crisis in the United States, and Ohio is among the highest for being affected by this. So this program provides peer recovery supporters to parents who are in the child welfare system who are struggling with substance use disorder. And peer recovery supporters are coaches, they're people who have lived experience with substance use disorder themselves, but have not used in at least 3 years. And they also try to find people who have had prior child welfare experience themselves so that they can really talk to the family like, hey, on Thursday you have to go to court and this is what it's going to be like. This is what they're going to ask you. I'll go with you if you want, so that they really have an understanding of both of those systems, the substance use system and the child welfare system. It's funded by Victims of Crime Act dollars from the Ohio Attorney General, soon to be the Ohio Governor, because he just got elected. And we are using a quasi-experimental design comparing the child maltreatment rates within the Ohio START counties, which there are 35 of them, largely rural and Appalachian counties, to the SACWIS child welfare administrative data from other Ohio counties. And then we also have pre-post family surveys for those who are participating. This is our RPG grant, the Regional Partnership Grant. It's called Enhancing Permanency in Children and Families. It's funded by Administration on Children and Families. It's a $3 million grant. It's a 5-year project in 2 Ohio counties. And in that one, kind of like Ohio START Plus. So we have the peer recovery supporters, but then we're also putting into place some of these other interventions. So family treatment, drug court, medication assisted treatment, and then we have the nurturing parenting program for kinship caregivers, but it's specific to caring for kids who have experienced this type of trauma. So many of the children within the child welfare system in Ohio have seen their parents overdose. They think their parent died and they saw them come back to life when they were revived with Narcan. And I think we don't have any idea yet the depth of the trauma that these kids have experienced. And so this, in many cases, the grandparent is now caring for the child unless they suffer from the same addiction. But we have all these grandparents now who are caring for children a second time. And not only has parenting changed in the past 20 years, but they also don't really know how to deal with this traumatic situation. And many of them want to maintain the connection with their adult child, who is the parent of their grandchild. And so trying to help them to set boundaries so that that can happen in a safe way. So that part's pretty cool. I'm pretty excited about it. we're doing a quasi-experimental design for that one as well. We tried to do a randomization into, because both of the counties have Ohio Start as well as the EPIC, but we just ran into some issues there. One of them is doing a pretty good job where they're doing a 1, 2, 3, where the first is Start, second family gets EPIC, and the third family gets treatment as usual. But the other county was very resistant. So we're doing quasi-experimental where we're going to do some propensity score matching to try to find equivalent families. We're looking both at the administrative data. We have a lot of data on the services that they received, and then we're doing, again, a pre-post family survey. This is the new grant that we just received. It's from the Office of Minority Health. It's a $1 million 3-year project. And this project is really trying to bring communities together to form community action boards in order to try to get more naloxone into the communities. And so in Ohio, we have the second highest overdose rate for heroin deaths in the country. There are so many people dying. It's very, very tragic. And so naloxone is an easy way that we can intervene on this problem right now. I want to see a lot more work on prevention end of things, but right now we need to keep people alive. And so trying to empower communities to get the naloxone into the communities, and that requires a lot of education because there's still a lot of resistance in naloxone within our communities. And then we're also providing education to the kinship caregivers who we're providing naloxone directly to, not just around how to administer the naloxone, but also what this is going to be like. Because a lot of times when they are revived, they're they can be violent, right? And so it's just not this easy thing to do. And then also providing support to the kid that's in child welfare who may have witnessed this happen. So this one is a quasi-experimental, non-equivalent control group design where we're looking at the rates of naloxone and the availability of naloxone in these communities compared to the communities where we're not located. And we have 5 counties where we're doing this. And then finally, I'm evaluating some programs for the Ohio Children's Trust Fund. So I'm the lead evaluator for the Central Ohio Regional Prevention Council. And we have 2 different interventions. One of them is the Triple P Positive Parenting Program, but the other one is a pilot project, which I'm very excited about. And we're connecting pregnant women who have opioid use disorder and are seeking substance use services to prenatal care. And we're teaming with child welfare to try to prevent the automatic removal of children because in many counties that is the protocol. And so we're trying to prevent that from happening. And then we're providing parenting education that's very specific to the context of caring for a newborn who may have just been weaned off of opiates, where there's having a newborn is hard for anybody. Having a newborn when you have a substance use disorder can be very triggering. And then having a newborn who has these additional challenges can be even more triggering. So trying to get them ready for that. So some neighborhoods look like the one with the swans, and some neighborhoods look like lots of apartment buildings, but some neighborhoods look like this. And so this is something that I'm really interested in, is understanding how what we know about neighborhoods in the urban context translates to the rural context. And so there's a lot of reasons to think it might be very different. The access to services is wildly different in rural areas compared to urban areas. The connections between neighbors may be tighter, but they also are more geographically dispersed. And so trying to understand how to measure this and then whether the constructs hold is an area that I'm very interested in. So I'm currently working on an R01, which will be submitted in February. We're submitting it to NICHD, and it's a natural extension off of some work that my colleagues were doing in Cleveland, Ohio. And our program officer is very excited about it. They've identified rural areas as an underserved, under-researched population. So I'm optimistic. I know first chance may not happen, but we'll be doing a mixed method, study where we're starting with qualitative to understand the extent to which the tools that we've been using in the urban context make sense in the rural context. And then we will adapt those measures accordingly and then do a large quantitative survey to try to understand neighborhood processes in rural areas. I'm also curious, I'm also very interested in continuing to evaluate prevention programs. That was why I got into this business. I want to continue doing that work. So natural funders of this work are ACF, also potentially the Michigan Department of Health and Human Services, as well as the Michigan Children's Trust Fund. I've worked with the equivalents of those agencies in both Ohio and Wisconsin and successfully gotten funding from both of those. So I'm hopeful that that would be the case here. So I talked a lot about research, but I do love to teach, and so I don't want that to get lost here. I do try to bridge my research into the classroom. So I created a course called Family Violence Across the Lifespan, and I collaborated with the community in order to create that class with the Child Advocacy Center that's attached to our Children's Hospital. And so that's a lot of fun because they get the research end of things from me and the theory end of things, and then they get the really on the ground piece from the practitioners who are really working with victims today. And so they can talk about what it's like to work with victims. They can talk about vicarious trauma and things like that. So that's been a lot of fun. And it's great to be able to bring a lot of my personal research into the classroom for that. I also like to teach research courses as well as program evaluation, and I bring my own personal experiences from working within state government as well as the research that I continue to conduct into the classroom. One specific example, when I was teaching an undergraduate research course, I had previously worked with someone from Wisconsin on a program called Community Response. And she had collected all this data but had no idea what to do with it. She was a child welfare worker and just really didn't know what to do with the data. And so 4 times throughout the course of the semester, we did similar to a Skype, where I had her up on the screen and my whole class was talking to her she talked about the challenges of doing research, but also the importance of doing research. And then they created an evaluation plan for her, which she then implemented. So that was a really cool collaboration and something that I love to do. I think that students really, when you're able to bring in your personal practice experience and your personal research experiences, it makes it a lot more real for them. I have experience teaching at all levels, undergrad, master's, and PhD. I have experience teaching online and face-to-face. I've taught electives on family violence and poverty. I've created both of those courses myself, and I teach them now. I like to teach research methods, policy, and program evaluation. Here at the University of Michigan, there are many courses that I would be excited to teach, including Introduction to Social Welfare Policy and Services. I was just meeting with Barb earlier about your new pathways that you're considering, and I'm very excited about that. I think that there's lots of good fit for the type of work that I do. And so I'm interested in the University of Michigan. I think that there are such great resources here and opportunities for me to collaborate. I'm really excited about the great work at the Child and Adolescent Data Lab. I think that there would be really good connections with my work, and I think that I could contribute and bring something new to the lab. I was also excited to learn about the Parenting and Context Research Lab. I watched Shauna's video on the website and was excited to hear about the social support intervention that's going on. I've identified several people, many of whom are in this room, that I could collaborate with, Dr. Grogan Kaler, Dr. Ryan, Dr. Herencall, also Dr. Lee. Let's see, but I'm not wearing my glasses. And then there are also really good interdisciplinary opportunities here for me. In thinking about who to meet with for this visit, I found lots of different people in nursing and psychology and medicine that are doing this type of opioid research that I have been focused on lately, that I think would be some rich collaborations for me. And I also love your joint PhD program because I think that that just really creates this natural collaboration. I'm also interested just in Michigan as a state. So this map I did not make either of these maps, I have to tell you. I love making maps, but I did not make these. I found them online. This one on the right-hand side is the rurality. So the orange dots are the urban areas. And you can see that there's lots of rural areas within the state of Michigan. And I know you have Dr. Addie Weaver, who is focused in rural areas. I think that would be a great collaboration for me as well. And then this map on the left-hand side is your opioid deaths within the state of Michigan. So you can see that there are some concentrated areas where you see much higher rates of death. So I know that you haven't been spared from this problem either. So I think that my research could make a big contribution. I have identified some state partners here as well. And I think I'm over on time, I'm sorry, but thank you very much for your attention.
So folks, feel free to ask Dr. Maguire-Jack any questions about her presentation or other things on your mind. We have about 20 minutes or so.
Mhm.
So, Katie, I'm Linda Decca. Nice to meet you. And I had a kind of a specific question about your study that you presented. So, I'll just ask it and see what you think about it. So, I noticed that you used parenting stress as a control variable. And in so many studies of child maltreatment, parenting stress is really looked at as a mediating variable, and it's really quite highly correlated with actual abuse and neglect indicators.
Mhm.
And so I wanted to ask you just to comment a little bit on, um, you know, well, if you remember how much it did correlate with child maltreatment in your study and the implications of using it as a control variable as you did, as opposed to a more mediating variable. Or I know you were interested in poverty. I would say even maybe not even looking at it as a variable in the model if you weren't particularly interested in that as a precursor to
Mhm.
actual maltreatment.
Mhm. That's a great question. So within this specific study, we did not run it with and without parenting stress. We included it because we wanted to parse out the effects of the parenting stress versus the maltreatment behaviors, the behaviors that they were exhibiting. But I think it's a great question because using the same data, I did um, look at access to social services in another paper, and we did look at parenting stress as a mediator of that. So we thought that perhaps living closer to services may decrease your parenting stress, which then, and we did find that it did mediate that relationship. So I think that's a great question, and I think it's a great suggestion to see what would happen if we took it out. I wonder how the models would change. I don't know the answer to that, just because we had always included it.
Yeah.
So, yeah, but thank you.
Can I just ask a question about kind of your, as a fellow prevention
Mhm.
colleague? I'm wondering about sort of the theoretical lens, the theoretical orientation to some of the work that you do in social disorganization, and whether there are limitations that you can think of the theory. And I ask in part because I have, in my own work, sort of come to a place of really wanting to sort of lead with asset building
Mm,
and more kind of strengths oriented
yes.
kinds of perspectives. And I'm just curious if that's something that you think about and
Yeah.
have incorporated into your.
Yeah, I do think about that a lot because even just the name of it is so deficit based, right? The social disorganization theory. And I do think that there are limitations, especially as it relates to child maltreatment. Dr. Cliff Emery has done work in this area trying to, because the social control questions specifically ask about whether you would intervene if you saw kids spray painting graffiti or a fight breaking out and all of these different things that we can maybe objectively say are wrong. And when it comes to child maltreatment or interpersonal violence, it's a much we react differently in this society. So we feel, I mean, probably everybody in this room has experienced being at a grocery store where you see something problematic happening between a parent and a child, and you have no idea what to do, right? And so Cliff Emery's critique of this, which I think is fair, has been that even if you have high rates of social control on those measures, the extent to which that translates into whether people would actually intervene if they saw um, uh, intimate partner violence happening or child maltreatment happening is very, we don't know if those things really correlate with each other. So I do think that that's a huge limitation. And then in terms of the deficit space, I do agree, especially with the structural characteristics. I think so I always tend to think of myself as the protective side of things because I'm looking at prevention, right? And so it's like what the lens that I have taken on this work is, we know that, and I usually have this picture that I show that has kids in child welfare, and then the circle that's kids in poverty. But then you have the kids in poverty and the kids in child welfare, because you do run the risk of creating this belief that poverty causes maltreatment and everyone in poverty will maltreat their child. And that's absolutely systematically not true. Um, but so the thing that I'm interested in is understanding in these communities where, based on these structural characteristics, we would expect to see higher rates, but we don't. How can we build on the strengths within those communities, and what is going on within the communities to prevent it from happening? But I absolutely agree that we need to have that type of shift, because I think in terms of the prevention messaging world, when we focus on the problems within, even when we talk about child abuse, it seems like someone else's problem. It's this other group, and that would never happen in my community, or that would never happen in my family. And so when you make it like a poor people's problem, or a disadvantaged community's problem, it limits the extent to which people want to get involved and feel like they own the problem. So I agree. Yeah. Mhm. Yes, Joe.
So in your study of the neighborhood, you had no race effects that emerged for explaining your three maltreatment characteristics, right? And I'm assuming Ohio, I don't know the particular county, Franklin County, I'm going to assume it's the same as every other county in the country where there's big problems with overrepresentation.
Yeah.
And so I was wondering, what do you think explains that?
So actually, it's not true. It's just not in the table. So these are not the only significant ones. It's just these were the main research questions.
I see.
Yeah. So we did, and I actually using the same data in one of the previous slides. We were looking specifically at race. It was this one, and so the first research question was whether there were differential rates of maltreatment based on race, and we did find that, and this was self-report measures. This was not, so it's a little different than overrepresentation because it's not subject to the decision making. But the Black families did report higher rates of physical abuse and neglect within our sample, and then they were less protected by the services. So we do have the same problem in Columbus that we have everywhere else. Yeah. There you go.
It may relate back to Todd's question and the last question. So I'm just curious about your thinking about perceived poverty, um, and the idea of perceived poverty being different, perhaps between urban families and suburban families, and urban families, and the idea of perceived poverty also as it may differ across racial and ethnic lines.
Mm-hmm.
And to what extent the perception affects how you report
Yeah.
about it, and to what extent many families, I mean, I didn't work in rural areas, but I did a lot of work in urban areas, where families were much more invested in actually hiding the poverty than necessarily exposing the poverty. So how does that work in terms of measurements, where I'm the poor family in the more affluent neighborhood, and how does that actually become visible?
Mm-hmm.
Is part of what I'm asking.
Mm-hmm. Yeah, I think that's a great question, because I think that absolutely does happen where like your bar is different for among, if you're thinking about, I think this happens with poverty and it happens with maltreatment, where if there's a certain level of acceptability of different things across different neighborhoods. And so I absolutely think that that affects things. I did not measure that in this study in terms of what would be acceptable. But I think that that is a really interesting question. And there is some work around community norms, specifically related to child abuse and neglect, not poverty. But I think that would be a really interesting thing to consider and to look at. One thing in this study that we just got published. It was really interesting because among the sample, so this was all kids within the United States that were maltreated from 2009 to 2015, and neighborhood poverty. No, that's the wrong. This one, community poverty, was actually, so at the county level, higher rates of poverty were associated with a decreased likelihood of substantiated maltreatment among investigated kids. And so it seems that, and that was really contrary to what I expected to happen, but I talked with my colleague, Sarah Font, and we really talked through this. And so she was previously a child welfare worker and was talking about how your bar changes based on where you are. And so, if you're in a higher income neighborhood and there's one child who's sent to school without a winter jacket, that kid is more noticed, right? But if you're in a lower income neighborhood where teachers supplying coats for everybody, then what you consider to be maltreatment can change. So I think it's a really important question, and it's something I haven't delved too deeply into, but it's something that I'm very interested in. And I think, especially now that I'm moving into this rural area, I think that brings in a whole nother level of this. Yeah. We did do some parenting groups around corporal punishment, and we had done them in urban areas, and we're talking about the research and what the research says about spanking children and whether that relates to child aggression, and doing the same presentation in rural areas where this is very anecdotal, but receiving feedback from parents like, well, if you spank your child, the research suggests they're more likely to become aggressive, and the parents saying, good, I don't want my son to be a sissy. Like, I want them to be able to fight back. And so just thinking about how the context really can matter, right? And of course, that's very anecdotal. I'm not trying to create stereotypes about rural areas, but that was just our experience. So. Yes.
So now this is a really big picture question.
Yeah.
So it's, your program of research is really impressive, and you've had a number of years to work on it. You know the literature very well. And you're not only have looked at the community factors, which is the study you showed, but it looks like some of your current research is actually looking at program outcomes.
Mm-hmm.
So I wanted to ask you, based on your great knowledge in this field, what do you think are the essentials or the most promising direction or the key components to successful prevention of child maltreatment? And you can break it down to just neglect or to, I realize that when we say child maltreatment, it's a broad spectrum of social problems.
Yeah. I think so. I think the social service array is critical. I think improving access to social services and the quality of those social services. I think especially poverty. I think that there is a very significant link between poverty and both abuse and neglect, but more so neglect. I think increasing access to public benefits for families is critical. And then I think another piece of the puzzle is sort of normalizing the fact that everybody needs help on this, that needing assistance with parenting is not just for the bad parents who make it to child protective services. I think we need to normalize that parenting is hard for every single person, and providing really good information to those who have natural connections with parents in a non-stigmatized way. So for example, pediatricians, I know myself as a parent, I had a 6-month-old daughter, and I got a fact sheet from my fact sheet with a lowercase f from my pediatrician on how if my child was not sleeping through the night at this point, that I was like destroying her life, basically. That I need to stop, and it gave me tips on how to let her cry through the night, and that that was the pathway. She was never going to sleep if I didn't do that. And so giving them really good information, because parents do go to these informal sources for information. And so why not give them the best information that we have today, right? I think pediatricians are a natural connection. I also think childcare providers play a really important role for parents, and they know the child often just as well as the parent does. And to say, hey, I noticed that Jimmy has been doing this. That must be really stressful at home. Have you tried this different thing? I think that making it non-stigmatizing to get that kind of parenting support is critical. But then I think the other piece of it, because of this connection between poverty and maltreatment in this country, especially, being able to reduce poverty is a critical piece of it. Yes.
So can I build on Lynn's question?
Sure.
And ask, so to what extent do you think that the existing child welfare system can play a role in this, what I think of as sort of progressive universalism? It's kind of a public health framework, right, that I think you're describing. where we sort of lead with messages to the general population, not just about preventing child abuse and neglect, but promoting well-being.
Well-being, yeah.
So speak a little bit, if you would, just about the ways in which current systems, particularly child welfare, can play a role.
Yeah, it would be a huge shift, at least with the systems that I've worked with. And so, and I don't mean to pick on the child welfare system at all, because they are completely overextended and under-resourced, and trying to just do the intervention side of things is incredibly difficult for them. So every time that we have tried to work with them to try to infuse more prevention in, they say that's not our role, or that would be great, but we don't have time for that. We are barely making ends meet as it is. And so I think that we would have to see a shift in terms of the resources provided to the child welfare agencies. In the state of Ohio, we're in a an especially bad situation, and we have the lowest state investment in child welfare services in the entire country. So they really rely on local investments, and so local county tax levies are very critical, but only half of our counties have them. So half of them don't, and the only money they get is from the federal dollars. And so we have some counties where there's like a 0.5 FTE for the whole county. That's their child welfare system. So I think you would really need to infuse more resources into it. And then I think you'd also have to work on the public service, what's the word I'm looking for, like the image of the child welfare system, because it's not really seen as an agency you want to engage with, right? It's a punitive system that if you're engaged with the child welfare system, you did something wrong, right? And so I think you would have to do some work to overcome that. And I don't think it's impossible, because we have examples like in the state of Minnesota, for example, where they have this, they were one of the first states to implement alternative response, but included in that was this parent support outreach program, which is not true primary prevention, because they still came to the attention of child welfare services, but they got screened out and said they don't meet the statutory requirements. And they're reaching out to families, and they are finding that families will engage in the parent support outreach program. So I don't think it's impossible. I think it is possible. In terms of extending it further for more primary prevention, where families don't have any kind of risks, I would love to see that happen. And I think that under the Family First Act, I do think we have some more ability than we've ever had before to be creative on this. And I know that some states are really embracing that and trying to do a lot more prevention work. So I don't think we're at a place where we could just do it right now. I think that there would have to be some planning put into place and a lot more resources. But I do think it could be possible.
Maybe for one more question, if somebody has one. And if not, just thank Katie for her presentation.
Thank you. Thank you so much.